Hi, good morning. Today's lecture is on survival analysis for beginners. I am Dr. Sandheep Sugadan, Associate Professor in Community Medicine, Quest International University, Malaysia. Let us go through this research question. For how many years did patients who had undergone a heart transplantation live? Which statistical tests can be used? There are so many statistical tests. For chi-square test, the outcome should be categorical variable and independent variable also should be categorical. Here, outcome is categorical. How many are dead? How many are alive? That is categorical variable, dead or alive. But independent variable here is not categorical. How many years did patients who had undergone a heart transplantation live? So we cannot apply chi-square test. For t-test, outcome should be continuous variable and independent variable should be categorical and should have two categories. Here, outcome is categorical variable. So we cannot apply t-test. For t-test, outcome should be continuous variable and independent variable should be categorical. For ANOVA test also, outcome should be continuous variable and independent variable should be categorical and have more than two categories. So we cannot apply ANOVA also here. We can apply a new type of analysis. It is survival analysis. We are studying the survival time. How many years or how much period of time patients survive before they get an event. Here in this example, event is death due to heart disease subsequent to heart transplantation. In logistic regression analysis, we were interested in studying how risk factors were associated with presence or absence of disease. There also outcome was binary, disease present, disease absent. And independent variable were different risk factors. Here, sometimes we are interested in how a risk factor or treatment affects the time to disease or some other event. If we are studying the association between risk factor and outcome alone, we can apply logistic regression analysis. But here, independent variable or risk factor affects the time to disease or time to the event. So in such case, we can use survival analysis. Or second scenario, we may have study dropout and there are subjects who we are not sure if they had disease or not. Many people are dropping out from this study and we are not sure how many of them get the disease, how many of them not getting the disease. We need to include that dropout also in calculation of study, calculation of findings of this study. In these cases, logistic regression is not appropriate. We need to use survival analysis. Survival analysis is used to analyze data in which the time until the event is of interest, time duration until the development of outcome or development of event. Event can be death, event can be some complication, event can be stroke, or event can be some reoccurrence of disease. How a risk factor or treatment affects the time to disease or time to the event. Example of independent variable. Okay, what are the time variables? Time until tumor recurrence, time until cardiovascular death after some cardiovascular intervention, treatment intervention, time until development of AIDS for HIV positive individuals. These are the independent variables. Independent variables can be time until tumor recurrence, time until cardiovascular death, or time until any event. Let us go through an example of survival analysis. It is one of the earliest examples in 1669. Christian Huygens, okay, he plotted a curve of 100 people till 86 years of age. Okay, how many people survived after each year was plotted. After 6 years, 64 was alive. After 16 years, 40 were alive. After 26 years, 25 were alive. After 36 years of birth, 16 were alive. And after 76 years of birth, only one was alive. Okay, this was the plotting of survival. What was a person's chance of surviving past 20 years? Okay, past 20 years, maybe around 30. 30 people were alive. 30 people were alive after 20 years of age. So that means 30% is the chance of surviving. Past 36 years, only 16 were surviving. That's so 16 was the chance of surviving after 36 years of age. This is survival analysis. We are trying to estimate this curve. Only the outcome can be any binary event, not just death. Okay. What is survival analysis? Survival analysis includes statistical methods for analyzing longitudinal data on the occurrence of events. Events may include death or injury or onset of illness, recovery from illness. These are all binary variables, or transition above or below a clinical threshold of a meaningful continuous variable, that is CD4 count. All of us know if CD4 count, CD4 lymphocyte count is less than 200, that shows immunocompromised stage. So reaching that threshold level of below 200, that also can be one outcome or event. Independent variable is the time to event from exposure. From the time of exposure to the event. What is the duration? That's the independent variable. Accommodates data from randomized clinical trial or cohort study design. Please keep in mind the survival analysis data are based on longitudinal research. Data is collected more than once. So for cross-sectional studies, we cannot apply survival analysis. Randomized clinical trial. This is the format. Okay. From target population, we are randomly assigning two group of people. One is a treatment group and the other is control group. Treatment group will get an intervention or treatment. Control group will not get that intervention or treatment. Sometimes control group may get placebo treatment. Sometimes control group may not get any treatment. Understood? Then we will be following them up till the event. What is the event here? Is a cure. Cure is the event. Cure or not cured is the event. This is a framework for a randomized clinical trial. Another framework, outcome or endpoint can be dead or alive. Okay, same target population is randomly allocated into either treatment group or control group and they are followed up for a period of time, and dead or alive are the outcome or events. So if we are doing survival analysis, the event yes or no will be the outcome and the time, survival time, will be time from start of treatment to the event. Okay. In a cohort study, target population will be divided into exposed group and unexposed group. Okay. Before dividing them into exposed and unexposed group, we should make sure that they are disease free. Okay. First make sure that they are free from disease. Then we divide them into one cohort which is exposed cohort, exposed to a risk factor, exposed to a treatment or intervention. Another group will be unexposed cohort. Not exposed cohort will be not exposed to risk factor or any treatment. And we are following them up for a period of time. How many of them develop disease? How many of them remain disease free? And in this case also we can apply survival analysis. Outcome will be events. Disease present or disease absent. And the time, survival time will be time from exposure to development of disease. That is the time. This is one graph of survival. Low fat diet and invasive breast cancer. This study was published in 2006. Okay. It showed that intervention group is having lower cumulative hazard. Okay. Intervention group was getting low fat diet. Those who were taking low fat diet were having lower hazard. That means development of breast cancer, invasive breast cancer was lower in intervention group with a low fat diet. The other comparison group were having higher invasive breast cancer hazard. Okay, so hazard ratio, hazard among intervention group divided by hazard among control group. Okay, that's a hazard ratio. So it was 0.91. That means hazard was lower in the intervention group. In the low fat diet group, hazard was lower. And a 95% confidence interval of hazard ratio was from 0.83 to 1.01. Because it was crossing the null value of 1, it is not statistically significant. Okay. Another retrospective cohort study was done to know the effectiveness of aspirin, ibuprofen, and mortality after myocardial infarction. It's a retrospective cohort study. One group was getting aspirin alone, One group was getting aspirin and other non-steroidal and inflammatory drugs. And one group was getting aspirin and ibuprofen. So their survival, okay, patients' survival was uh, studied, and survival was higher for aspirin and ibuprofen group. Survival was lowest for aspirin alone group, and survival was between these two groups for aspirin and other non-steroidal anti-inflammatory drug group. Okay, now we can go through objectives of survival analysis. Estimate time to event for a group of individuals, such as time until second heart attack for a group of myocardial infarction patients. Time to second heart attack, that is time to event for a group of myocardial infarction patients. To compare time to event between two or more groups, such as treated with placebo myocardial infarction patients in a randomized controlled trial. Treatment group and placebo group. Okay, so what is a time to event in treatment group, time to event in placebo group? That can be studied. To assess the relationship of covariables to time to event, such as does weight, insulin resistance, or cholesterol influence survival time of myocardial infarction patients. Expected time to event is equal to 1 divided by incidence rate. Why to use survival analysis? Why not compare mean time to event between your groups using t-test or linear regression? So we are looking for the mean time to event in both groups. Why we cannot use t-test or linear regression analysis? T-test or linear regression ignores censoring. Censoring means those who are not continuing the treatment till the end. Okay, so we can see in detail what is censoring. Why not compare proportion of events in your groups using risk ratio or odds ratio or logistic regression? Okay, you may be thinking that each group, what is the risk of development of event or development of outcome? Risk or odds ratio or logistic regression ignores time. Okay, so if we are looking for time alone, okay, we cannot apply t-test or linear regression because t-test or linear regression ignores censoring. How many people are dropping out? They are not considering. Then you may think that we can use risk ratio or odds ratio or logistic regression. That also cannot be done because risk ratio or odds ratio ignores time. Survival analysis, we need to learn so many terms. What are the terms? Time to event, time from entry into the study until a subject has a particular outcome or a participant has a particular outcome. That is the time to event. Censor. Subjects are said to be censored if they are lost to follow up or drop out of the study, or if the study ends before they die or have an outcome of interest. Okay, they are counted as alive or disease free for the time they were enrolled in the study. If dropout is related to both outcome and treatment, dropouts may bias the result. Event. What is the event here? Death, disease occurrence, or disease recurrence can be an event. Recovery can be an event, or other experience of interest is also an event. Time. The time from the beginning of an observation period, such as surgery or beginning treatment, to an event. Event or end of study or loss of contact or withdrawal from the study. So if event happens, that's the event is positive. If no event happened till the end of study, it is considered as censored. Loss of contact occur or study participant withdraw from the study. That is also considered as censored. Censoring or censored observation. A subject does not experience the event before the study ends. That is considered as censored or censoring. A subject does not experience the event. Second one, a person is lost to follow up during the study period. A person is lost to follow up during the study period. That is also considered as censored. A person withdraws from the study. Withdraws from the study. In between the study, he withdraws from the study. That is also considered as censored observation. These are known as right censoring. Okay. After starting of study, event does not occur or person lost to follow up. We are not able to get the data about the patient or person withdraws from the study. Person is there but he withdraws from the study. These are examples of right censoring. Survival function is the probability that a subject survives longer than time t. Okay, there is a time is there. The probability that subject survives longer than time t. That is a survival. Types of right censoring. Okay, there are three types of right censoring. Fixed type 1 censoring, random type 1 censoring, and a type 2 censoring. What is fixed type 1 censoring? It occurs when a study is designed to end after C years of follow-up. In this case, everyone who does not have an event observed during the course of study is censored at a C years. That is a fixed type 1 censoring. We are telling we will continue the research for 3 years. At the end of 3 years, whoever didn't get the outcome, whoever didn't get the event will be automatically censored. Fixed type 1 censoring occurs when a study is designed to end after C years of follow-up. In this case, everyone who doesn't have an event observed during the course of the study is censored at the end of C years. That is fixed type 1 censoring. Random type 1 censoring. The study is designed to end after C years. But censored subjects do not all have the same censoring time. Okay, random type 1 censoring means censored subjects do not all have the same censoring time. Some may be censored before the end of C years. Some may be censored at the end of C years. This is a main type of right censoring we will be concerned with. Some may get drop out in between. Some data is not available. That will be censored earlier than the end of C years. In type 2 censoring, a study ends where there is a pre-specified number of events. Okay, at the end of 50 deaths or 20 deaths, study ends. So there is no fixed period is there. So whoever not experiencing the event at that time, okay, will be censored. Data structure for survival analysis. Two variable outcome. Time variable, that is Ti, that is a time at event. The time duration when event occur, that is a time variable. Censoring variable, that is Ci, equal to 1 if had an event. Ci is equal to 0 when no event by time Ti. Okay. So time event is a continuous variable. It is a time at event. Okay. At the time of event, how much time is finished from the beginning of the study. Censoring variable can have two categories. Ci is equal to 1 or Ci is equal to 0. Ci equal to 1 means had the event. Ci is equal to 0 means no event by the time Ti.